about the president's repeated claim that if you like your plan, you can keep it, was never really mentioned to the American people when the president was time and again saying this in the run-up to the passage of that law. Isn't a central question here, Jay, did the president mislead the American people when he made that comment repeatedly?
Jim, no, the president was clear about a basic fact. If you had insurance that you liked on the individual market and you wanted to keep that insurance through 2010, 11, 12, 13, and in perpetuity if you wanted it and it was available, you could. You were grandfathered in. What no healthcare reform could envision or could responsibly stipulate is that any plan that might come along in the next few years would be grandfathered in, because that would undermine the basic premise of providing minimum benefits for the American people. So again, in all of these cases, what is absolutely true is that if you had a plan before the Affordable Care Act that you liked on the individual market, and your insurance company didn't take that away from you and offer you instead something else that you then purchased, but they provided you the same plan this whole time, you can keep it. And that's true. And if you're, again, and I again would encourage you and others to...
There are people out there who don't, or who do like their plan, as crummy as it might be in the views of this White House. Those folks are not being able to keep their plan in some of these cases in the individual market because it does not meet the requirements of the law as it stands now or as it will be next year. So I just don't understand how you can say that the president's claim back in 2009 and 2010, if you like your plan, you can keep it, was an accurate claim.
Well, Jim, again,
who are now losing their insurance. It just doesn't.
But Jim, you're basically saying that if somebody bought a plan on December 15th that did not provide hospital coverage, did not provide maternity benefits, charged your sister, if you have one, double what they charged you, even if she's a twin and genetically the same. So I'm just saying that the whole isn't worried about being put in the hospital. That is precisely the point, because that there are 27-year-olds out there who, well, that goes right. That goes to the fundamental debate about whose responsibility it is to cover the costs of that 27-year-old when he or she ends up in the emergency room. Because if he's not covered or she's not covered, you're paying the cost and you're paying the cost and I'm paying the cost. And that's not fair to taxpayers who deal with those costs or to individuals on the private insurance market who absorb those costs through their own insurance plans.
But this isn't really a new issue. PolitiFact said back in 2010 that this was a half-true. Factcheck.org said the president can't make this claim back in 2009. So there are questions about this claim.
You're saying on the one hand people didn't know, and on the other hand they did. So the claim the president was making, the only claim we could make, because we couldn't predict what plans would exist between the passage of the law and the full implementation of it, was that if you had a plan prior to the passage of the Affordable Care Act that you liked, you could keep that plan and stay on it, even if you might get a better deal with better benefits through the marketplaces. But it is true, and there was a debate about this, and I'm sure there will continue to be a debate, that a fundamental premise of the Affordable Care Act is that there ought to be minimum standards for insurance coverage for everybody. And that is what the marketplaces provide.
One of the top Democrats in the House, Steny Hoyer, said this morning, I think preciseness would have been better. He was making that comment about the president's claim. If you like your plan, you can keep it.
Jim, I appreciate that, and I appreciate, as I was saying to another reporter, look, we can, if you want to make that point, you can. Again, I've explained exactly what was possible when the law was written. You can't grandfather in plans that didn't exist. You can't grandfather in people who didn't have insurance and then bought it in the interim.
Some precision might have been better on the president's part.
Jim, again, you can focus on that level, or if you do,
it's an important claim to focus on.
Absolutely, focus on.
This is something that the president said time and again to sell the health care law to the American people, and it was something that reassured millions of Americans out there that their plan would not be changed. So it's not something that we're just picking on one little thing here to make a big political point or conflate.
All I ask is that when you do the report, you note that anybody who had a plan the day before the Affordable Care Act passed and was signed into law, and has not been thrown off that plan and had it replaced by their insurer, has not dropped coverage of their own volition and then purchased it again in the interim, but has had that plan, is grandfathered in and can keep that plan. That is what we were saying, and that is a fact. Also, when you do this story, just please remember that the universe you're talking about here is 5%. That's the whole individual insurance market, 5% of the population. And that's an important 5%. That's a 5% that is of outsized concern to the drafters and implementers of the Affordable Care Act, because they're the ones, those are the Americans who have been most subject to the wild vagaries of the system as it existed before. The Affordable Care Act, who, you know, at the drop of the hat could have lost coverage or been told that their premiums were doubling or that they would no longer be able to get coverage for a specific condition because it was pre-existing. All that changes come January 1st.
Sorry, finally, does the president regret making that claim?
Jim, I think I've answered the question.
It should have been more precise.
The president said, as many others, that clear. All of these populations are not affected by what happens on the individual market. But if you had a plan on the individual market and you liked it and you like it and you've kept it, you can keep it forever as long as, Jim, I think I stipulate that, and I think it's important to talk to insurers, Jim, because if you ask them, do they want those consumers, those customers out there who are now shopping around for the options available to them on the individual market, options that almost by definition are superior to the ones they've had before? The answer the insurers will tell you is yes, and they are going to aggressively pursue those customers because the Affordable Care Act has changed the entire dynamic of the marketplace so that you don't have a marketplace in which it is the sensible business decision for insurers to deny coverage to you if you're sick or charge a woman twice the price or you know, refuse basic services like maternity care or mental health services. It is in their interest now to sign up as many customers as they can, and because this system now allows for individuals on this market to purchase affordable health insurance that they haven't been able to purchase before. John.
If I can switch subjects.